Ghana has and is still enjoying a remarkable coverage of vaccination against preventable diseases for its citizens, particularly children. By 2018, Ghana's coverage of immunization using Penta-3 as proxy was 97%. Ghana has been among leading countries in Africa in the coverage of immunization and is currently using 13 vaccines with Gavi's support. Despite the remarkable progress with the coverage, there exist financing gaps that require critical attention from the government if the SDG 3 and other international and national policies, such as the WHO's Regional Strategic Plan for Immunization, the Comprehensive Multi-Year Action Plan, the Addis Declaration on Immunization, the Abuja Declaration, and political commitments are to be achieved. All these treaties enjoin member states to move from globally driven immunization agendas to nationally owned immunization programs with increased national budget allocations and political commitment. Again, the sustainability of this feat could be threatened if a source of domestic financing is not guaranteed.
Immunization protects the children against diseases, and as it's protecting the children against diseases, it's also giving the mother ample time to do other things. When children are sick, it takes a lot of time from the mother and even other caregivers, the family as a whole. And so when we immunize our children, it protects them against diseases. And even as it protects them against diseases, it makes them healthful adults. When they grow into adulthood, they are healthy. And with immunizing our children, when we do that and we prevent them from getting diseases, it means that we don't even have to spend money in taking them to the hospital when they are sick. So it ends up being cheaper to immunize your children. You may have to take a transport to go and immunize your child, but at the end of the day, you are preventing yourself from visiting the hospital several times because your child does not have to get those diseases.
Oftentimes, when we talk about improved living standards, our minds always go to the work we do, the income we earn, the kinds of schools we attend, even the infrastructure that is around us. But immunization is one of the most cost-effective ways of improving living standards, of improving health outcomes, and also to guarantee us good economic prospects. And I say this because if children are immunized, they are protected from diseases. And when that happens, it improves their IQ. It gives them good health. And if they are healthy, their parents will not spend time taking care of them. They would use that time to be more productive, making income and helping the economy.
You classify government support to immunization programming under goods and services, and that is where we leave so much for IGF. And IGF is a function of the ability of the health facilities to mobilize. And if you have challenges with national health insurance and so on and so forth, it limits the extent to which they fund, they're able to get IGF, and therefore provide that counterpart funding. And so it leaves small room for the health facilities to be able to meet their requirement, their obligation regarding financing of IGF-related activities. And that is where you would have expected, ideally, the district assemblies to also come in to provide some support for immunization programming. And that has not been consistent in one way or the other. So it has even been difficult to capture that data in a more consistent way.
First of all, I would say, currently, as we are even seated here, when you look at the number, you can see the children are more than us. And as we always say that the children are the future of every country. let's assume all these children are left behind without being immunized. The effects is that a lot of diseases is going to affect them. And then it means we don't have a future, because some of these diseases might take their life, might paralyze them, and then might even affect their thinking ability.
When children are immunized, it results in reduced child mortality. You know, when children die often, then families are kind of forced to have many children, because then you are thinking, okay, if I have 7 and 4 die, at least I'll have 3. But if children are immunized, we know that they are going to be protected from these diseases that may kill them. And so a family can just decide that, okay, we will have 3 children and then end it there.
Just let's give 1,000 people, which may be a small fraction of the population, but if the country is to take care of their economic needs and we factor it per annum, then we'll see that, look, it would have been better we did that immunization years back than waiting for this to become a cost on the nation. So in terms of economic impact, 1, we are losing human resources. 2, we are losing productive hands that could have brought something useful to grow the economy. 3, as far as they are not productive and they are not contributing, that portion of capital that should push our GDP or whatever it is in the economy is also affected. Secondly, in health-wise, we are now going to have people who the government will have to spend money if they have to be on whether they are a national health insurance scheme or whatever, the government will still spend money.
In terms of government's commitment to provide counterpart funding to IGF, since 2012 thereabout, we have consistently failed as a country to meet that obligation. And if I may quote some figures here, in 2012, for example, we only provided 20%, as opposed 46% that we were supposed to provide as our routine immunization expenditure that is supposed to be financed by government. In 2013, we went up to 16%, but it fell short of the 45% expectation. In 2014, 19%, 2015, 24%, 2016, that's where we did well by providing 40%. And at that time, the expectation was that we were supposed to pay 46%. So this is the year that we did well by only having a shortfall of 6%. Then we fell to 35% in 2017. So you realize that consistently we have not been able to meet our obligation, and that gives bad signal, because we are aware that by 2026, Ghana will be required to fully take up the issue of financing immunization. So if we are not showing commitment in terms of meeting that obligation, one wonders whether as a country we will be able to meet that obligation when it finally falls on our lap to take care of all the financing arrangements so far as immunization is concerned.
Immunization of children is an investment. If Ghana invests in immunizing all children under 5 years now, Ghana stands to benefit and reap the gains in the future. And so that will mean that put in money now and harvest the result in future. So I believe government has plans for all children who are also citizens. Immunization is a right, and children have that right. So now if Ghana doesn't transit properly, we stand the chance of losing our children. I will propose that government of Ghana from now on start investing money, putting money aside to stand on its own in case donors especially Gavi transit one day. We have domestic resources. There are taxes that we all pay. I know there's a lot of development going on in this country, but the children also need a share of whatever their parents are contributing to the development of the nation. And so I would suggest that the government of Ghana allocate explicit resources for immunization and ensure that these resources are not touched by anybody. There should be policy that says that nobody should touch that money, and so that when donors transit one day and they are not bringing money for immunization, we can fall on that money.
If I am Gavi, my obligation is such that it depends on your obligation as well. So if you don't pay yours for a particular year, then there's an avenue to rearrange and pay, but then you have to pay the ensuing year as well, together with all the arrears. If that doesn't happen, then Gavi withholds its grants, including vaccine grants, including grants for HSS, which is the health system strengthening. And it has a lot of implications, because it means you won't get the vaccines, you won't get the support for the health system.
In as much as we are doing well currently as a country by ensuring that our children or the children are being immunized, we also realize that it's all donor funded. Let's assume tomorrow they get up and they say, we said they are not going to fund us again. It means that all these children are going to be left there at the peril of their lives.
The more people get sick in a country, the higher the cost of healthcare. And that money that government will spend on healthcare could have been channeled into other sources of the economy to grow there. So if we look broadly speaking, it will be very, very, very short-sighted for governments to say we are putting priority on infrastructure or some other place in the economy which can give quick evidence for people to say, yes, we are doing well, and leave immunization.
So what I would suggest is that government should start falling on private sector, domestic resources, looking at our tax, and put some resources aside. One thing that the government can also do is now immediately identifying development partners, private sector, private for-profit, who have interest in the life of children, and start signing partnerships with them so that they can support Ghana during the transition time and after transition, when donors are no more bringing us money.
When you're not immunized, your body is unable to fight certain diseases, and when you get those diseases, the consequence sometimes can be fatal. Sometimes they are lifelong consequences. I think not too long ago, you see a lot of people having the effects of polio. But these days, you don't see that anymore. And you know, when people have polio, the disability limits their capacity to do things, their productivity capacity. And so those are some of the disadvantages of not immunizing the population. And also, we spend a lot of money in trying to cure those diseases. Most of these diseases that we immunize, I think they don't have a cure. So you would have to live with the consequences of those diseases. And it's time consuming and it's expensive.
Sustainable Development Goal, especially Goal 3, which is looking at health. And I believe that the government has a lot of plans. I would suggest that we should have a national dialogue on immunization and other health issues as a country, bringing everybody together. And then we all come together and see what we can all contribute to sustaining our health.